Most diabetics must control their blood sugar with insulin injections, which lower the glucose level. But a new survey has found that the stigma of obesity, often associated with diabetes, means some are risking their long-term health to hide their illness.
So if they go out for a meal, they'll have to take their medication with them. And people feel embarrassed about using the medication in public. So they skip it and don't use it at all. And what that means is actually their blood glucose levels run typically too high. Now in the short term, that doesn't cause really very many problems. But the issue is that in the long term, having very high blood glucose levels causes really, really significant problems for the body.
Problems like heart attack, stroke, blindness, and even amputations. Very low blood glucose levels can lead to hypoglycemia, with rapid heartbeat, blurry vision, fainting, and even death if it's not reversed. Howard Cox was diagnosed with type 2 diabetes 20 years ago at the age of 45 and has been injecting insulin for the last 10 years. He says sometimes too high is better than too low.
I don't put too much insulin into me before I play golf, because what you don't want on the 9th or 10th hole is for all of a sudden your brain to go a bit awry. So you leave it a little bit high deliberately so that you can play the round of golf.
While not all type 2 diabetics are obese, the majority are. And Pemberton says they can find the holiday season an especially sensitive time with mixed messages from the media.
They're kind of pushing kind of high-calorie, unhealthy foods and saying that it's somehow a treat and that we deserve it. And on the other hand, we're bombarded by images of kind of people being very slim and this kind of totally unobtainable, idealized body image. So actually, people are really confused.
He adds, however, there's no confusing the risks of not controlling blood sugar. Faith Lapidus, VOA News.